to find out, to reality test it out. Another well-known technique among voice hearers in order to cope with distressing voices is to learn to use relaxation techniques. This is a technique that's best to do when you're not hearing voices. In other words, to learn how to do deep breathing, to breathe in by the count of 3, and to breathe out through your nose by the count of 3, to breathe in through your nose and out through your mouth to the count of 3. All of that can be something that you can learn to begin to calm your body, to make you more relaxed. And as you practice that when you're not hearing voices, practice it 2 to 3 times a day, then when the voices do start up, you can, for instance, use that relaxation response, do your deep breathing, and get yourself grounded. But it's best to practice that one when you're not hearing voices, and then invoke it once you've learned it, once the voice hearing begins. And finally, I want to say something about the importance of peer support. Research has shown that the people who are the most overwhelmed and whose lives become the most disrupted over a period of time by voices are those who are the most isolated and don't have a chance to talk about it. There's nothing to be ashamed about in having a voice hearing experience, and there is hope, and there are ways to cope with it and get on with life. And that sometimes peer support can be the key to breaking out of the isolation and being able to share with someone else who sort of walked in your shoes, in a sense, before. And there's that experience of finding another voice hearer, sharing lessons on the path to recovery. There's nothing more powerful and healing.
Okay. So Pat Deegan is actually has schizophrenia herself, and she was able to develop this so that everybody can really experience what it's like and hopefully be able to understand a little bit more if you're working with somebody who's hearing voices. So the next step, if I can have, Jessica, can you help? I'm going to have Jessica pass out the MP3 player and the headset. And we're going to go ahead and get started. We're going to do 3 different things. We're going to have a group stay in this room and work on an activity. I'll probably have Renee, if you can just be outside while people walk around just to make sure they're doing okay. And then Jessica Chase will be helping, and one group, there's benches outside. We'll go out there and sit, and she's going to ask you a series of questions. And you're going to do all of these while you're listening to the voices. Probably there's going to be a 3-minute introduction from Pat, which you'll hear, and then it will get started. So once everybody has their MP3 players and their headphones, I'll take you through the steps that we need to do to get it turned on. Again, if it gets to be too much and you don't feel comfortable, you can turn the volume down. But if I encourage you not to if you're okay, because we really want you to get the experience. The other thing is please feel free to talk to each other, because we want you to talk, but don't talk about what you're listening to. Because, I don't want you to compare what the other person's hearing. And that can be really difficult, but we really encourage that you don't, because again, it's going to take away from the experience.